Hi, I'm Dr. Paul Fisher, and today I want to talk about how chiropractors can help with temporal mandibular joint disorder, or TMJD. Now, for those of you who are familiar with this, you already know, but for those of you who aren't, this is an issue with the jaw. This area right here where your jaw meets up with your skull, best shown here. Now, if you are suffering or know someone suffering from TMJD, you know how painful this can be, how chewing, even eating, going throughout their day, how that can just be such a severe pain going from here up to the head here, down into the jaw. This can cause headaches, but it can also make it difficult to eat, difficult to sleep, difficult to relax. Many times, this is aggravated by stress. So when you get stressed, it gets more painful, which increases the stress, which makes it more painful. Not a good situation to be in. And this can really be a very long-term painful situation if not appropriately treated. Many of the patients we see in this office have dealt with TMJD for 6 months, 1, 2, 3, 4 years before they really got to the core of what's going on. So how can chiropractors help with TMJD? Well, the simplest is that there's a huge correlation between your neck and your jaw. If your neck has a proper curve, your jaw effectively balances out your head. The muscles here don't need to work as hard as they would if you don't have the proper curve, and then your jaw goes here. When it flips down, the muscles here and here effectively have to spasm and clench very tightly to keep your jaw where it's supposed to and help maintain the balance in your head. Now, you're probably also thinking, can this be related to pain in the shoulders, upper neck? Yes, absolutely. But the jaw, because that's such an important joint in your body, think of how much you eat. This is typically where a lot of people focus their pain on. So the way that we treat TMJD is, one, we work on the neck to make sure that this balances out the jaw. I'm not a dentist. We are not going to work with appliances, bite guards, night guards, anything like that to work to change your jaw. Some of the alignment options, whether they be braces or clear aligner, Invisalign is an extremely popular and good one, but how that will change the bite, we don't work with. What we do work with and have phenomenal success with is correcting the curve in the neck, but even more so, these muscles here on the side of your head, right here by the side of your jaw, they can be spastic for months or even years. And as chiropractors, what we're able to do is work to decrease the tension in those muscles. Many times we can do this with simple manual therapy techniques, but we also have dry needling, cold laser if the case is extremely severe. For those of you who are aware, the pain here can be extremely excruciating. There's also many times we have patients with TMJD that will get a fullness or an issue with their ears. We also have adjustments that can help clear out the ear canal, make sure that everything's flowing the way that it's supposed to. So that's really how chiropractic can help with TMJD. A big issue is working on the curve of the neck, correcting the muscles around the jaw here, and also the skull. Those areas really decreasing the tension. We'll also work with lifestyle changes, and we work hand in hand with oral health care providers. So again, thank you so much for your interest, and have a nice day.